basis. So yeah, it's something that flies under the radar. You don't really hear people saying, oh, I can't have that. I'm watching my blood sugar, or I'm really feeling like my blood sugar is out of balance today. It's just not something that we really talk about. So my objective here today and throughout this webinar is to convince you that blood sugar is something to be aware of for your health. And to do that, we aim to do what we usually do at FoodSmart in general, which is to share education around these nutrition topics. So what blood sugar is, how it works in the body, why it matters, and some things that you can keep in mind or practices that you can implement in your day-to-day life that can help you manage and balance your blood sugar, and in turn, improve your energy, your health, and a bunch of other things that we will dive into. So buckle up. We are going to get into some science. If you've attended a FoodSmart webinar, or specifically one that I've hosted in the past, you know that I really love to dig into the science. I think it's helpful to have a foundation of understanding before we just talk about practical tips. So we'll dig into that. Then we will get to some practical tips so you can truly feel like you can master your blood sugar with nutrition. Remember, you can ask questions in the chat as we go, and we will answer as many as possible at the end, depending on time. And yes, we will be sending this out so that you can rewatch it, or you can share it with friends and family. So we will get started. And of course, as we are going through this, if you're like, hey, this is really interesting, I would love to speak with someone one-on-one about this topic. Luckily, we have dietitians in every state who you can connect with virtually by phone or video on your schedule, and they are experts in nutrition, and they can listen to your unique health and goals and create a program that works for you. So remember, today we're looking at general kind of guidelines, advice, little tips you can take away, but really it is helpful to meet with someone who can really dig into your needs specifically. So if you've been to our webinars before, you know that we usually do a giveaway for scheduling a visit with a dietitian within 24 hours of the webinar. So today we're giving away your choice of a $250 prize. You can choose a Fitbit Versa, a Vitamix One blender, or a $250 Amazon gift card. So Justin, my lovely assistant, will drop the link in the chat to schedule that visit, and you can click through to schedule, and just make sure you use the code SUGAR when you do. I'll give him a second just to drop that in there. Awesome. Thank you, Justin. All right, let's get into it. So on the agenda today, we will look at the basics of blood sugar. So understanding where blood sugar actually comes from and what happens when we eat certain types of food. Then we will briefly talk about some symptoms of imbalanced blood sugar. After that, we will look at some health effects that can come up from imbalanced blood sugar, as well as some health conditions like diabetes. And then we will end with some simple strategies that you can incorporate to help you keep things balanced and either improve your health or help prevent some of these issues from developing. So we'll start with the basics of blood sugar. Now, what is blood sugar? Nearly all of the energy used in living cells comes from the bonds. So that molecule on the screen comes from the bonds of sugar, specifically glucose. So in other words, the energy our body uses to run, jump, breathe, have a heart rate, grow, everything depends on glucose. Now, how does glucose get into these cells? Well, it circulates in our blood, and when it's in our blood, it's called blood sugar. And then a hormone called insulin takes that sugar out of our blood into the various cells, depending on what the body needs. And it does this in a very delicate and highly orchestrated way to ensure blood sugar balance, meaning that the amount of sugar in our blood is neither too high or too low, and that the cells have the energy that they need to do their jobs. Don't get scared of this graph. So how does blood sugar, though, how does glucose get into our blood in the first place? Well, like everything else, it comes from what we eat, right? So our food consisting of macronutrients, carbohydrates, fats, protein, those things are all broken down into their singular components or their smallest form. So proteins are broken down into amino acids, fats are broken down into glycerol and fatty acids, and carbs are broken down directly into glucose. And actually, depending on the body's needs, some amino acids from protein, some glycerol, some from fats, those can all be converted to glucose as well through various different processes. But generally, all of these components are broken down, and that breaking down process produces the energy for the cells. Of all of these different ways of producing energy, the body generally prefers glucose for energy. Why? Because it is the easiest to break down, and turn it into energy. So it is the path of least resistance. So the body is actually going to choose to use glucose in most cases, in most cells. So glucose is incredibly important. Now let's look at carbs, zoom in on carbs for just a second, to really look at the direct impact of glucose on the body. Remember, carbs go directly to glucose. So when we eat carbs, our blood sugar is always going to go up, no matter what. Carbs break down in our digestion, they are absorbed into the bloodstream as glucose. And so this is a natural response. This is okay. This is something we expect. A little bit of a spike or a lot of a spike, we can always expect some kind of response to eating glucose. What we are trying to avoid here are those really big swings. So high spikes, low dips, over and over again over time. And there are things that can affect just how much our glucose spikes, like whether you ate fiber or what other things you ate with your meal. And we'll come back to some of those things, but just want to note that discrepancy there. So one way to measure or think about whether food will cause a small or a large glucose spike is a scale called a glycemic index, which is just a rating system that measures how quickly a particular food will affect your blood sugar when it's eaten in isolation. So that's an important component there. If you are diabetic, you are maybe familiar with glycemic index as a tool to kind of think about food. So yeah, a high GI, we'll call glycemic index GI. High GI foods are things like straight up sugar, sweets, sugar sweetened beverages. It can be like white rice, pasta, breads too, things that are really quick sources of energy. They are broken down really quickly into glucose. They cause your blood sugar level to rise very rapidly and very high. They cause, in response to that, a rapid release of insulin to get that blood sugar back down. And they'll also cause, because of that, a quick release of energy. And they will cause you to feel hungry sooner. We'll dig into that in a sec too. Low GI foods, on the other end, are broken down more slowly. So they are things like vegetables, fruits, whole grains, things normally with fiber. So we have a sweet potato on the slide. And those, like I said, are broken down more slowly. They cause blood sugar levels to rise more slowly, not quite as high. They cause a steadier release of insulin, and in turn, a slow, steady release of energy, and they cause you to feel fuller for longer. So it's important to note that this isn't a scale of foods that are good or bad, or that you should or should not eat. Like everything in this webinar, this is just to provide you information to consider as you're making decisions about your own health. It is one data point, but it can be a helpful way to think about foods if blood sugar is a concern for you. Great. Now, let's consider those high glucose spikes that happen for a second. So that was the left side of the previous slide. And let's say we eat a whole cake all at once on an empty stomach. What's really going to happen? So when we spike our glucose that high, the body reacts in a few ways. So principally, insulin flies out of the bloodstream to grab up all that glucose and bring it into the cells that can use it for energy. You may have heard of the term insulin sensitivity. We want our insulin to be sensitive to glucose so that it responds quickly and it lowers our blood glucose appropriately. When we have those high spikes, like the one we saw in this slide, the body sends out an army of insulin, and this excess insulin response can lead to a rapid and substantial decrease in blood sugar levels. So that's when we see this really, really high, feeling great, loving life. That was really good cake, coming back down a little bit pretty rapidly. And because the body responds with so much insulin, sometimes that can cause you to go kind of below that normal range. And that can lead to something called hypoglycemia, which someone I know in the chat said that they had, which is low blood sugar. And so you felt really great. You've come back down. You've maybe gone too far. Now you're not feeling so great. Maybe you've now got some low energy. If it's too low, you can feel some much more severe symptoms like shakiness, dizziness. You can just feel sleepy, just lethargic, or kind of like you're having an energy crash. And what happens when you feel that way? Well, you're probably going to want more sweets to kind of help you feel better again. And so you can see how that cycle continues. Not feeling so great, need to feel great again, got to eat some more sugar, glucose spike again, and we kind of go on and on and on. So that is what is really happening there. I would like to pause for a second and make just a quick point before we continue, which is that liking sweets, sorry, Justin, yes, other slide. You're good. Liking sweets is not a personal failing, okay? We are designed to love sweets. The body prefers glucose, remember, as an energy source. You are biologically inclined to go after sugar and sweets, just like this baby. And there's a reason that it tastes so good. I think the problem is that we live in a food environment that makes overconsumption of sweets way too convenient, difficult to resist, hard to get away from, honestly. It's really in so much of our food, even when you may not think that it is. It's hidden on labels and different kind of annotations or under different names that are hard to identify. If we think about like our ancestors' availability of sweets, let's say, I don't know, 300 years ago, probably even less sooner than that, it was 1,000 times less common than it is today. Sweets would have been maybe some occasional honey or whole fruit. And today we have to actively try to avoid too much sugar because it is in everything. So there are a lot of factors that make managing and balancing your blood sugar really difficult that have nothing to do with you. So I just want to say that as someone who loves sweets as well, I get it. It's really hard to resist. It is not a personal failing, and it's okay to also enjoy sweets, which we'll talk about. So with that said, let's look at a few examples of symptoms that you might experience if your blood sugar is, let's say, out of balance. Okay, so first being cravings. So if our blood sugar drops too low, like we talked about a second ago, we can crave those quick sources of energy. And if we're consistently spiking and tanking our blood sugar by eating sweets, then craving sweets and eating sweets, we get stuck in that cycle, right? The energy peaks and crashes follow that exact same pattern. You can also experience increased hunger. So despite having high blood sugar levels, the body's cells maybe aren't getting enough energy that they need, which leads to increased hunger. And that could indicate insulin or hormonal issues. So something that you might experience if your blood sugar is, again, we're just generally saying imbalanced. So too high, too low, not in the right balance there. Could also experience GI issues, specifically candida or other types of yeasts that feed on sugar. So consuming a lot of sugar can have impacts on your gut health. Specifically, it can cause overgrowth of some of these yeasts or other types of bacterial dysbiosis. So that can be a sign. Skin issues as well. So increased instances of acne. Wrinkles actually can be impacted by something called glycation, which comes from inflammation, which can be caused by high sugar or lots of spikes of sugar over time. And it can also be related to those GI issues. Level of consumption. Are you just eating a ton of sugar? I know I personally run into this. I kind of tend to notice when, I'm craving sugar, maybe I'm eating a lot of it, like that can also, those cravings themselves and your consumption being really high can indicate maybe you've got some imbalances going on. If you are experiencing actual hyperglycemia or hypoglycemia, so if you're experiencing high blood sugar or low blood sugar, maybe you've had a test that shows that your blood sugar is high or low, that's obviously a sign that there can be some imbalances there going on. Just a reminder too that symptoms are really highly individual, and this is certainly not an exhaustive list, but these are some of the common ones. So if you are concerned, it is important to work with a doctor or your dietitian to help identify if there's an issue there that needs to be addressed. So now let's look at some not so sweet health effects and conditions that can arise from dysregulated blood sugar. So we're going to go through some issues that can arise, as I said, from unbalanced blood sugar over time. Looking at some of the more immediate effects from, let's say, a single blood sugar spike to what happens if these things persist over time, over days, months, years. And remember that we are talking about unbalanced blood sugar generally, not one specific condition here. Okay. So starting with short-term effects, the highs and lows of unbalanced blood sugar, we can think about a single glucose spike here. So again, there's that graph. If you remember, you saw your blood sugar going up after consuming that high food, creating a glucose spike because the insulin response goes back down, and we can see it fall below that optimal level. So when blood sugar spikes, that is called hyperglycemia, and that can cause a cascade of effects like inflammation. Touched on this a second ago, but giant spikes in glucose actually cause our mitochondria to produce something called free radicals, which can lead to oxidative stress and inflammation in the body. These have all kinds of effects. I'm sure you guys are familiar with inflammation and its relationship to pretty much every type of disease. But it can affect specifically our skin, our digestion, our DNA, our GI, and that can be local to the area, or in the case of blood sugar, it's often systemic inflammation, so all over the body. We also have those energy peaks and crashes, which we've talked about, which can in turn make you crave more sugar to get that energy back up. Sugar spikes can also affect hunger hormonally, impacting leptin and ghrelin, which control our hunger and satiety cues. When we eat sugar, our serotonin, so that happy face at the very top of that peak, goes way up. So our mood goes way up. We're feeling great. When we spike hormones like that, they regulate. And again, in the same way that insulin regulates, can go back down, maybe a little lower. So you may not feel as great after some time. It can also obviously affect the hormone we've talked a lot about, insulin, which is directly related to blood sugar regulation. It can also affect cortisol. So cortisol is our stress hormone. And eating sugar, lots of sugars, having high spikes, having sustained high blood sugar as well, can cause cortisol to stay elevated. So hypoglycemia, or low blood sugar, is a little less common, but it can be more serious in the short term. So our bodies generally do a good job of regulating here, but you can experience short-term hypoglycemia after eating a lot of sugar. Again, what we've talked about, dipping back too low. And this can be also related to other health conditions too. So if you're experiencing this, it's important to chat with your provider. But you may experience things like dizziness, shakiness, weakness, paleness, sweating, rapid heart rate, headache. Could just be mood changes or irritability. So, being hangry is kind of common phrase nowadays. It can be related to low blood sugar. And like I said, it can potentially be more serious and result as a result of these intense glucose spikes and related to other medical conditions. Just as a quick reminder too, we have these glucose spikes every single day. It is fine to have these glucose spikes in the short term, right? Our body is resilient. It is made to handle these certain amount of inflammation, dysregulation, having to handle varying degrees of spikes. It's okay. It's not something to panic about. This is just to kind of look at, all right, what happens most immediately when we eat that sugar in the short term? So we'll move on now to the medium term. Right. So when the problems start to creep in are when we have these large spikes, like the one we just saw multiple times a day, day after day, month after month, over years, that we begin to see some of these more concerning effects. And one of the most concerning effects is something called insulin resistance. Now, remember how we learned that insulin is responsible for getting blood glucose out of the blood and into the cells, and it's a good thing for our insulin response to be sensitive? Well, the opposite of insulin sensitivity is something called insulin resistance. Now, over time, insulin resistance can develop and make our cells less responsive to insulin, making it harder for our blood sugar to be lowered. And this can become a vicious cycle that leads to prediabetes or diabetes. Now, a number of things can lead to insulin resistance, like that are not blood sugar related, genetics, age, certain medical conditions. However, we do see a higher incidence in people who are physically inactive, who have metabolic disorders like increased visceral fat around the midsection, and in those who have diets that are made up of ultra-processed foods, lots of sugar, and lots of alcohol. Now, insulin resistance is a metabolic condition. It is not a medical diagnosis. It is a risk factor, though, to developing prediabetes and diabetes, which are medical diagnoses. It can also exacerbate all of those short-term effects that we looked at. So the inflammation, the hormonal issues, it can also impact weight control or how easily we're able to maintain a healthy weight for us. So how can you tell if you have it? It's really working with a provider, and they will look at your medical history. They will look at your symptoms if you're having any of those short-term symptoms. And there are also various glucose tests that you can get to help identify if this is a concern. So oral glucose tolerance tests, fasting blood glucose tests, HbA1c, which measures blood glucose stability over time. And you can also test insulin level directly. So those are some of the tests your provider might look at, but that is how you would kind of determine whether this is an issue for you. Okay, so long-term effects. What happens over years and years of continuing to have some of these blood sugar imbalances? We start to see prediabetes and diabetes. Now, prediabetes, I noticed lots of you guys in the chat as you were coming in said that this is something that you deal with. And, you know, it affects actually as of 2021, affects 34% of the US adult population. And many people actually have no idea that they have it. So this is a medical condition indicating elevated blood sugar. It is, you know, diagnosed with fasting glucose in a range between 100 and 125, HbA1c levels between 5.7 and 6.4. These are kind of standardized ranges. Your doctor will find what is most relevant to you. Prediabetes is really the opportunity to intervene and say, hey, we've got some warning signs. Now is maybe a good time to look at some lifestyle changes, because left unchecked, it can lead directly to developing type 2 diabetes. So moving on to type 2 diabetes, this is characterized by insulin resistance directly. So at this point, the body's cells either do not respond effectively to insulin, or you're not really able to produce adequate insulin in the pancreas, which makes blood sugar control very difficult or impossible to do without intervention. The two other types of diabetes I have listed here are not able to be entirely impacted by diet alone. Type 1 is an autoimmune condition, and gestational can be improved marginally with diet, but it also has a really significant hormonal component, in that gestational occurs during pregnancy as well. So both of those are a little bit more complex. Type 2 is really the one that we see that is most related to diet and lifestyle, and most kind of comes as a result of prediabetes. So left unmanaged, diabetes can lead to really serious health effects like heart failure, nerve degeneration, retinopathy, and lots of other things. So it's really good to be aware of that. The good news, though, is that both prediabetes and diabetes type 2 can usually be managed and improved by, as I said, lifestyle changes. So that includes physical activity and nutrition. And improving nutrition specifically because of the sugar component there can be a really important strategy to even preventing the development of some of these effects, both short and long term. So pause for a second. If what we are talking about today is resonating with you and you'd like some help figuring out what kind of nutrition plan is right for you, you're in luck. At FoodSmart, we know that this is really complicated and it can be overwhelming and hard to figure out what's right for you. And we really don't believe in one size fits all, but that it's important to treat the individual, and that personalized nutrition support leads to the best outcomes. So there's so much value in having an expert like a registered dietitian on your team to help you find answers and adapt and support you over time, especially when we are talking about conditions that affect so many people and that can be managed effectively with nutrition. So encourage you to take just another second and follow the link in the chat that lovely assistant Justin will drop in there to schedule a visit with a dietitian. You know, it's a great step to take as a part of your kind of entire medical care team, just to focus really on nutrition, specifically when it's relating to blood sugar management and diabetes. So follow the link in the chat. We are in network with a number of insurance providers and employers, so it's likely that your visit may be covered, and you can check that when you are signing up. And plus, you will obviously be eligible to enter our $250 prize giveaway, which is very exciting. Now, let's take a breather. I just sped through a lot of science, and I know that. So make sure you get your questions in the chat. I'm happy to come back to anything that was maybe confusing or that I sped through too quickly. But we are now going to get into some practical tips that you can employ to help your blood sugar stay balanced day to day. Again, these are just general tips that have been shown in various scientific studies to minimize those spikes and the drops and help you stay more balanced. But we really recommend that personalized approach. And this is not advice specifically for your instance of diabetes or your particular scenario. So we will get into those. All right. So the first one, maybe a little too obvious, right? But avoid spikes. Okay, so how do we do that? Well, we can revisit some of the concepts that we've learned about related to what types of foods tend to spike our blood sugar more than others and the glycemic index. And we can think about how to use that information to structure our meals. So one way to do that is to think about the order in which we eat foods. It's been shown that starting a meal with foods that are lower on that glycemic index, like maybe fibrous vegetables or protein, before eating foods that are higher on the glycemic index, like pasta or white rice, can reduce the degree of glucose spikes that we see. So you can see in this graph here, we see that eating an arugula salad, for example, before eating pasta, you can see what that looks like compared to eating only pasta. And what we see is more stable glucose when we eat the salad first. So you can see just the pasta, you get a higher spike and it stays elevated for longer. With the salad and then the spaghetti, you get the kind of more gradual spike. It doesn't go quite as high. It doesn't dip quite as low. And so that is what we are that's what balanced kind of looks like if it were to be graphed. So that's a really good strategy. And that also means that dessert, right? So again, we are not villainizing sugar in any way. It's kind of in the how we approach and with what volume. And so, you know, having dessert after a meal that is full of fiber, protein, fat is great. And yeah, totally fine. So another thing you could try is essentially creating your own low glycemic food by pairing something that is maybe high glycemic, like sweets, with that protein, fiber, fat, or lower glycemic food. So remember that glycemic index is measuring foods eaten in isolation, which is basically not going to happen very often. So if you pair, let's say, a dessert or something that is high glycemic with something that is higher in fiber, that can also reduce the degree of your glucose spike. So we're talking about order of foods eaten here, and also just ensuring that when you are eating high glycemic foods, you are pairing them with things that will help regulate and slow down that spike. And lastly, just simply eating whole fruit. So back to the kind of ancestor example from earlier, this is how sugar is found in nature most often, except in the case of honey, but it's bound to something fibrous. So eating whole fruit will cause a lower spike in glucose than, say, drinking fruit juice, for example. Have a savory breakfast. So this looks really good. When we have been in a period of fasting, our bodies are especially sensitive to glucose. And that makes the first meal all the more important. And it can set us up for a day of stable energy. Or if we don't do that, it can set us up for a day with like lots of peaks and crashes in our blood glucose. So one basic formula for a savory breakfast is to include protein, a fat, and some fiber. You're probably picking up on that theme at this point. But proteins like Greek yogurt, tofu, meat, cheese, fats like butter, olive oil, avocados, especially choosing full fat foods because the fat-free, you don't have the fat. So it's not keeping you as full for as long and doesn't have quite as much of that stabilizing effect. And then fiber. So the best way to add fiber is by adding veggies. You can try mixing veggies maybe into an omelet. You can use it as a base in a bowl. So I like to do like a zucchini and a squash as sort of the base, add on some eggs or some scrambled tofu if you don't eat eggs on top. And then you can also top it with like mixed greens, spinach, tomatoes, whatever your favorite fruit is, add some protein in there. Could also do nuts and seeds, which are really great in fiber. And if you have that as sort of your baseline, feel free to add some starch. That's some toast, some potatoes, some rice, or some fruit as well. Totally fine. It's just kind of, again, having that foundation and specifically doing that as your first meal of the day when your body is a little bit more sensitive. Move after meals. So this is kind of an interesting one, and I find it's a little bit less, I guess, known, but using your muscles for about 10 minutes or within the kind of 10 to 15-minute period right after you eat actually shunts glucose out of the blood and to cells faster. So it helps the spikes not go as high. So you can think about, you've just eaten, your body's in the process of absorbing all of its nutrients. If you start moving your muscles, the insulin is going to come out and pull it out of the blood glucose as it's going in. So pulling it into your cells for energy as you're moving, as it's going into your blood glucose. So it can help kind of keep things a little bit more stable. And you can try it doing, it doesn't have to be, and it should not be high intensity because that can kind of disrupt digestion. You shouldn't, go jump on a trampoline maybe, but a gentle walk around the block, walking your dog, doing some easy yoga, doing an easy bike ride, like just some movement is enough there. So an interesting thing, I think, to keep in mind and pretty practical. Eating something acidic, specifically before you have something sweet. So scientists have found that a component in vinegar called acetic acid temporarily inactivates the digestive enzyme in our saliva that breaks down starch called alpha amylase. I'm going to say that again. When we eat, maybe as a kid, you did the experiment where you would put a saltine in your mouth and chew it up and it would turn sweet. That is alpha amylase. It's a digestive enzyme breaking down starch in our mouths, which is where digestion begins. So eating vinegar, you have this component called acetic acid, and it activates that alpha amylase, which means the sugar doesn't come away from the starch so soon. And as a result, the sugar and starch are transformed into glucose more slowly, and that glucose hits our system more gently, softly, slowly. So that's one component that vinegar or something acidic like vinegar can kind of do. The other one is that acetic acid, when it gets into the bloodstream, it actually penetrates our muscles and encourages them to make something called glycogen faster, which leads to more efficient glucose uptake. So it has two factors there: the glucose being released into the body slower and our muscles taking it up quicker means less free-flowing glucose around in our blood and less of that glucose spike. So this maybe kind of sounds like pseudoscience, but hopefully breaking it down into kind of the chemistry there makes a little bit of sense. I'm not encouraging you to go chug a bunch of vinegar or do apple cider vinegar cleanses or anything kind of, that extreme, but it's something to keep in mind. So even just eating like some pickles or some fermented food or having a little bit of lemon water, apple cider vinegar, yeah, it's great. Having a little bit of something before you're eating something sweet can help kind of reduce those spikes, which again is what we're after doing. So not avoiding sugar all the time, not avoiding spikes at all, but reducing how high they go, right? So vinegar is one way that you can do that. And last but never least is hydration. I feel like this is a tip for everything, right? Well, it does have three kind of major effects on blood glucose. So the first one is it improves insulin sensitivity, which remember is the thing that we want. So dehydration can actually lead to reduced insulin sensitivity, making it more challenging for the body to use insulin effectively. But when you are well hydrated, your cells can respond more efficiently to insulin, and it allows for better blood sugar regulation. The second one is enhanced circulation. So proper hydration supports optimal blood flow, volume, and circulation, which helps transport glucose from the bloodstream into cells to be used for energy. And yes, kidney function is the third one. So hydration is really essential for proper function of kidneys, which filter out waste products, including excess glucose from the bloodstream. So if you're dehydrated, that can strain the kidneys and impair that ability to kind of regulate blood sugar and that function. So stay hydrated. Okay. So I feel like that was top speed, but hopefully you guys are following along with me and picking up on some of those tips. So let's kind of revisit a little bit of what we've gone over in summary. So like I said at the beginning, the objective here is to convince you all that blood sugar is something that everyone should be aware of, but not afraid of, right? So liking blood sugar is not a personal failing. It is in our biology. Our bodies need and want glucose. It tastes good. It makes us happy. It's not something that we should have to, give up. But being aware of how it affects the body, which is what I hope to have kind of conveyed here with all of the science, it can help us think about how we can both, I guess, have our cake and eat it too, right? So be able to enjoy something that is sweet, and employ some strategies that help, minimize any potential damaging effects from blood sugar. Obviously, there are degrees there, depending on if you do already have diabetes versus if you're someone looking to prevent it. Again, this is general advice, but that is kind of the goal of what we went through today. We also want to remember there that we want insulin sensitivity, not resistance, and that nutrition plays a really important role there. So again, minimizing those glucose spikes by some of the tips that we looked at, and that slow and steady wins the cake. So again, slow and steady release of glucose is what we are trying to achieve when we are implementing the following kind of tips and practices. So going back through really quickly, those kind of spike stopping strategies, avoiding spikes with a balanced plate. So again, you can really come back to most times with nutrition, very basic kind of advice that is in practice in day-to-day lives, hard or easy to lose sight of, right? So a balanced plate, making sure you have your carbs, fats, proteins, and fiber as a part of your plate, staying hydrated as well. Really, really important to keep your blood volume and the concentration of glucose in your blood balanced. It really helps the body do its job in all aspects. Breaking your fast with something savory. So taking that balanced plate strategy, taking some of the meal timing or food timing strategy from the first slide. So starting with something fibrous or high in protein or fat, then having your sweets, same thing, especially at breakfast. So hopefully you've got some tips to help kind of create a savory breakfast. You can still have the pastry or the croissant, but do it after the salad or the scramble or the bowl, right? Moving after meals. So after you eat, stand up, walk around your house, walk your dog, go out and look at your garden, just get a little bit of movement there, nothing too intense, just to kind of help your muscles pull the glucose out of your bloodstream. And then try something acidic. So lots of really yummy acidic foods. Acid is kind of a taste that we don't have very frequently, I find, in kind of Western diets. Have a little bit of lemon water, have some pickles, have some sauerkraut or fermented foods. All of those things are hopefully really easy, really accessible tips to just kind of generally better balance blood sugar. Not a replacement for medication or any personal recommendations that you've gotten from your doctor, but things that are kind of low risk and hopefully should help. All right. Other last exciting really thing is we have Food Smart nutrition programs. So specifically, we have one for diabetes. These are 12-week tailored programs that your dietitian will walk you through. You can mention your diabetic or your prediabetes, or you have an interest in this program when you meet with your dietitian, and they will give you all that you need to know about it. But essentially, you will have weekly topics of discussion. You will have handouts that you can do, lots more tips like the ones that we've looked at today. You will also get access to the Food Smart app, where you can find examples of savory breakfasts or other high fiber meals, for example, or desserts with maybe not so much sugar, things like that. So a really great tool there. And as with all of our programs, they are always customized to be specific to you, your conditions, your needs, your lifestyle. So make sure you schedule the visit with a dietitian, chat with them if you're interested in a program or if not just about blood sugar in general or any of your other kind of health and nutrition related concerns. And make sure you use the code SUGAR when you sign up. All right. So with that, that's it. We will do our Q&A